Safe supply, regardless of where you are across the country, is a debate that is heating up. This month, we covered a new development in BC where doctors could be prescribing safe supply fentanyl to children and sometimes without the consent of their parents. And while that conversation certainly caused quite a buzz, there is another new development in the world of safe supply. According to our next guest, naturopaths in BC are lobbying the provincial government to be able to prescribe safe supply drugs. Joining us now to explain this radical proposal is Adam Zivo, columnist with the National Post. Adam, thank you very much for being back with us.
Thanks for having me back.
Your latest piece states that naturopaths are lobbying to be licensed to prescribe safe supply drugs. Why are they pushing to be able to prescribe controlled substances when most of what they're legally allowed to prescribe now are things like vitamin supplements and folic acid?
Well, so their rationale for this is that they want to help with the overdose crisis. And they've essentially framed this as a way to take away pressure from regular prescribers and other healthcare professionals. However, that framing is quite misleading because the problem isn't that doctors are too overwhelmed to prescribe safer supply or that supporting safer supply is taking them away from their other responsibilities. Rather, the issue is that most doctors do not support safer supply because they believe that it is irresponsible and potentially dangerous. So they are not prescribing it.
Irresponsible and dangerous in the context of these drugs ending up on the street, which you've obviously covered in previous stories, or is there something more there?
Just irresponsible in the sense of diversion. So these drugs ending up on the streets, getting in the hands of children. And of course, this idea that safer supply is not backed by any compelling research and seems to have no real benefits. Many doctors have reviewed the literature that supports safer supply and found it to be unconvincing.
Okay. So, medical doctors are more cautious now because they're worried about diversion, but what checks and balances would exist in comparison to medical settings if naturopaths were allowed to prescribe safe supply drugs?
Basically nothing, right? So the thing is that right now, access to safer supply comes in two forms. You have federally funded programs and clinics which just do safer supply, and they have relatively limited capacity. And then if you want to really normalize safer supply, you need to go through the other route, which is through regular prescribers. So your doctor can prescribe you safer supply if they believe that it is useful for your addiction. And of course, there are many more doctors available than these small clinics.
Mm-hmm.
The thing that doctors they have a lot of leeway to do this, but they don't think that it is responsible. And so they're not doing this. And they're actually increasingly abandoning safer supply as its harms become more evident. And so what safer supply advocates are pushing for is for lower tier health professionals to be able to prescribe safer supply despite not being able to prescribe much else. Mm-hmm. So as an example, registered nurses have been able to prescribe safer supply since 2020. And lobbying from naturopaths seems to follow this trend where if the experts won't do it, we'll get the people who are less experienced to do it instead.
Yeah, and so are the people who are pushing for this expansion simply just looking for a quick expansion of prescribing power to offset the reduction of medical doctors who are participating in safe supply?
Yes.
Okay.
So that's been a really significant thing.
And what are the material benefits here or financial benefits for naturopaths if they're actually allowed to prescribe these drugs?
Well, I mean, I would imagine they'd be able to make more money off of this if they're able to attract more clients and prescribe to them. We saw this being done with the prescription of medical marijuana before it was legalized.
Mm-hmm. And I mean, that would beg the question, is legalization an option? It was for cannabis. I'm not equating the two, but I'm sure some would make that argument.
Well, that's the thing is that safer supply advocates are now so frustrated with the fact that prescribers don't want to give out safer supply that they've actually pushed for a non-prescriber or non-medical model, which would allow heroin and fentanyl to be sold over the counter like Tylenol or alcohol, which obviously is not great.
So essentially legalization-ish.
Essentially, they've said that safer supply is not accessible enough, and so we have to make it accessible. One of the main proponents for safer supply in BC, Chief Coroner Lisa Lapointe, argued in November that this form of quasi-legalization should be permitted, but the government did shoot that down.
Adam, I really appreciate you taking the time to chat with us on this very interesting topic. We'll continue to have you on as this develops. So thank you for your time.
Thank you for having me once again.